Now you may begin.
Welcome, everybody. Thank you for joining us this morning. My name is Vinnie DeMarco. I'm the president of the Maryland Healthcare for All Coalition, and we are thrilled to be here working with the Health Equity Resource Communities program. This program was created in 2021 by legislation that was sponsored, and we'll hear from him in a second, by Delegate Jaz Lewis, one of our heroes in the legislature, and Senator Antonio Hayes, and former Delegate Eric Barron, who's now U.S. Attorney. The three of them were really committed to making sure that Maryland reduced health disparities and expanded health equity. And we at the Maryland Healthcare for All Coalition were proud to be the lead advocates with many of you in this room. A broad coalition of organizations worked very hard to enact this legislation. It was not easy. It was built on the successful health enterprise zones 2013, which had been allowed to phase out, unfortunately. And then one of our board members, Professor Daryl Gaskin, who's on the Zoom, wrote a terrific paper along with others showing how successful the health enterprise zones had been. And that's why Delegates Barron and Lewis and Senator Hayes said, let's re-up them. And we did in 2021. I want to thank them, and also Budget and Tax Committee, the Senate Chair, Guy Gazzone, for making sure that the health equity resource communities were created with two major differences from the previous law. One is it was permanent. The 2013 law phased out in 5 years, unfortunately, and it was not re-upped. This law is permanent. It's on the books of Maryland forever. And the other big difference, and thank you again to Chairman Gazzone for making this happen, is dedicated funding. That's why the program has now $41 million that's been given out to the grantees you'll hear from today because of that law in 2021. We cannot thank the delegates and senators enough for making this happen. And we have some more other legislators on the Zoom with us, including Delegate Sheila Ruth, Delegate Jennifer White Holland, Delegate Jen Teresa, and Public Health Committee Chair, Delegate Heather Bagnell. And I want to thank two terrific staff people who are with us, Spencer Dixon from Senator Dawn Giles' office, and Edith Perry from the office of the wonderful chair of the Health and Government Operations Committee, Delegate Jocelyn Pena-Melnick, who's been one of our all-time heroes forever. If you're a legislator on this, and I didn't mention your name, send me a note, and I'll make sure we mention you. Thank you very, very much, the legislature, for doing this. I also want to recognize some of our board members who are on with us. I mentioned Professor Daryl Gaskin, Reverend Lee Hudson is on, Jim Campbell, who did a lot with the AARP on this law, Len Lucci, who's also a terrific lobbyist. Thank you to them, and a couple of our major funders, without whose work we couldn't get this done, from the Able Foundation, Terry Staubmeyer and Liz Tung. Thank you all for being on. In a minute, I'm going to introduce the terrific head of the program, Nellie Washington, who will describe more what's going on right now. But right now, I want to take this moment to introduce one of my heroes in the legislature, Delegate Jaz Lewis. He fought hard for this law. I can tell you it wouldn't have happened without him. And I'm very pleased to have worked with him on many other public health issues and issues of social justice. He is known as one of the social justice leaders in the Maryland General Assembly. And he also has two little kids, one 4 and one under 1. And we thank him for taking the time with us today and for all you do in the Maryland General Assembly to improve health equity and improve public health all around. So before we talk about the program in particular, let me turn the floor over to the wonderful Delegate Jaz Lewis.
Thank you so much, Vinnie and Nellie and Catherine, the whole Healthcare for All team. I really believe we do all this in solidarity with one another. Good morning to everyone, and thank you for being here as we celebrate the impact and progress of the Maryland Health Equity Resource Community Program. I was especially honored to be one of the sponsors, along with Senator Antonio Hayes and former Delegate Eric Barron, now our U.S. Attorney, which I'm also very proud of his success. The HERC program, as you all know here, is about ensuring that every Marylander, no matter their zip code, has access to quality healthcare that they deserve. It's about leveling the playing field, bringing critical resources to communities that have been underserved for far too long. whether it's expanding access to primary care, behavioral health, or preventative services. This program is already making a real difference in closing health gaps across our state. And I've been particularly happy to tour some of the programs and see the implementation from St. Mary's to Prince George's to all over. By empowering local organizations and healthcare providers, HERC helps build collaborative, community-driven solutions that address the unique health challenges our communities are facing. But it's not just about the healthcare. It's about building healthier, more vibrant communities that give every Marylander the opportunity to thrive. I look forward to continuing to work in solidarity with all of you and doing what we can to establish permanent, long-term solution funding for the program. And look forward to hearing from all the grantees and more of the amazing work that you all are doing. So I'll hand it back to Nellie and Vincent, but thank you all for working in partnership.
Thank you, Delegate, and we look forward to continuing to work closely with you and make this program a success. And I also want to make sure we recognize the members of the Healthcare for All team. You saw already Deputy Director Catherine Kirk-Robbins, who did a lot to make the Zoom work. Deputy Director Stephanie Clapper, who has been instrumental in making this work. Deputy Director Suzanne Schlottman, and Reverend Sandra Connor, who you'll hear from later. Thank you to all of them. We are thrilled that entity running this operation is a Community Health Resource Commission headed by Mark Luckner that have done a tremendous job in making this happen. And one of Mark's best decisions was hiring Nellie Washington. We just loved Nellie from the beginning. We saw her in action through the Pathways grants, and then in making this process work to pick the grantees that are here today. It was not easy. And ladies and gentlemen, any of you who've been through a process like this know it was not easy. And we're so grateful for Nellie for heading up an effort that was fair, transparent, equitable, and ended up with terrific results. So with that, I'm going to turn it over to Nellie, who's going to give you an overview of the program, and then we'll break into the breakout sessions where you can actually talk with the individual grantees. So Nellie, all yours.
Thank you, Vinny. I'm going to begin with just sharing my slides. Everyone see this? Does someone say yes? Because I can no longer see you.
Yes, we can see you.
Okay, perfect. Oh, thank you, Vinny. It's always wonderful working with you and your amazing and passionate team. Thank you, Delegate Lewis, as well as Senator Hayes, who is not on the call, but for just being such great champions and advocates for the work, for folks across the state that often feel, I always say, unseen and unheard. Thank you to my wonderful HERC grantees for your tenacious commitment to helping. Thank you for taking the time to share information about your programs today. To all on the call, our registered guests, thank you for taking time out of your busy day to learn about the great, impactful work and share this program information with your respective communities and your respective platforms. Shout out and thanks to our esteemed commissioners, my CHRC team back at the office, and our expert HERC Advisory Committee members who play such a vital role in providing assistance, support, and guidance to our grantees through the program period. And I believe that we may have members on the call. So I'll just give a direct shout out to our subcommittee chair of community outreach and consumer engagement, Chair Elizabeth Chung. Hello, if she's on the call. Dr. Maura Dwyer and Michelle Spencer. Thank you all for all you do. So Vinny and Delegate Lewis shared a little bit of the history about the importance and the impact of legislation, the who, the what, and the why. The statute is clear in its approach to address health equity, in its approach and intent to address health equity across the state. To share a little bit of information with you about the 5 statutory policy objectives and priority of 2021 Maryland Health Equity Resource Act. This 2021 legislation is the foundation of our work, and our grantees, they know I've shared this, they've seen this a million times in the last 2 years. Legislation provision for 7 years of funding to address health equity statewide. And here you see the 5 policy objectives, which outline just how our HERCs will need to demonstrate what that impact looks like. These 5 policy objectives serve as the HERC programs, in my mind, their accountability stick to ensure that all of their activities and interventions map back to reducing health disparities, improving health outcomes, improving access to care, promoting prevention services, and reducing healthcare costs and hospital admissions. As I said, the legislation provision for 7 years of programming in 2 program phases. The first, the Pathways to Health Equity pilot program. That RFP was issued back in fall of 2021 and yielded 9 Pathways grantee awards in 2022. It was a 2-year program, actually 2 years and 2 months, where those Pathways grantees addressed clinical health disparities and a lot of social needs areas of address for participants and clients across the state. It served as a pilot, providing programmatic foundation, support, and guidance for those 9 Pathways programs to potentially become 5-year HERCs. That program was successful, yielding 11,000 community residents served, and that service was in clinical areas, connecting them to care, reducing those disparities and heightening their health outcomes. That program ended this summer, and we are now in the Health Equity Resource Communities phase. RFP, the HERC RFP was issued last fall, and that yielded 12 5-year grant awards. The work began this summer and will go through to the summer of 2029. The emphasis of this phase of programming is, of course, the longer term intervention. So you have the 5-year implementation period, not just 2, but with a much larger and greater address to those social determinants of health barriers. The goal of this program with our 12 grantees is to provide service and care, and well, clinically and non-clinically, to nearly 50,000 Marylanders. So at program end, if you think about what was accomplished in the Pathways phase and what will be accomplished in the HERC phase, there are over 60,000 Marylanders. And these folks are in underserved and vulnerable communities statewide. That's, to me, what impact looks like. And I'm super excited to get started. So we're here today to share some valuable information about 12 special programs, our 12 new HERC awardees. The goal today is very simple. We want to plant seeds that raise awareness, spread the word, and drive traffic to these program doors. So we have 12 programs, 5-year implementation period that begins now, begin this summer. Per the legislation, there were 5 approved organizational types that could serve as lead entities. We're so proud to say, and Vinny teed it up beautifully. The selection process was extremely fair, extremely transparent, and it was competitive. We had 59 applications, or 59 applications, with a request of over $240 million. We whittled that down to 12 awardees with a grant funding amount of nearly $42 million. And I'm proud to say that we have a very diverse cohort of lead organizations representing each organizational type. We have our F8 federally qualified health centers, our nonprofit hospitals and universities, as well as our community-based organizations and local health departments. All of our grantees have robust, and I mean robust, partnerships with organizations that provide both clinically and in address of those social determinants of health. They really aim help us not only clinically, improving access, outcomes, prevention, and breaking those barriers in health by assisting those with the most pressing social needs, those of whom we serve. Let's take a look at what that looks like. Extending the arm geographically. As I mentioned, under the pilot program, we began with 9 pathways programs. So from 9 pathways programs to now 12 HERTs, covering 10 jurisdictions across the state. And you see it kind of highlighted with the greens being the previous pathways grantees and the pinks being our new HERTs. So you see that coverage from one end of the state to the other. Actually see the geographical footprint of the HERTs across the state. We have 4 programs in Baltimore, 2 in suburban Maryland, and we have 6 programs in rural Maryland. 1 Southern Maryland, 3 on the Eastern Shore, and 2 in Western Maryland. These programs are targeting populations that need access. They are linking them to care from uninsured, communities of colors, folks with economic struggles, immigrant populations, experiencing homelessness, joblessness, or folks navigating the healthcare systems. The HERT programs are a group of passionate, and I do mean passionate, people that simply want to help. These are some of our clinical, these are a glimpse of our, a snapshot per se, of our clinical and health disparity spaces. Diabetes programs, hypertension and cardiovascular, obesity and weight management programs. We have mental health and social isolation. We have programs that address substance use disorder and abuse, program that addresses special population of sickle cell patients. We have programs that address not only maternal, but infant health, mortality and morbidity. We have programs that address childhood immunizations, and we have programs that address elder care. So let's dig a little bit deeper into each of those programs. As mentioned, we have 4 programs that provide care and services in Baltimore City. Our first, MedStar Health, addresses maternal and child health disparities in South Baltimore. Interventions include establishment of a new Or for Healthy Babies hub site that provides care coordinations with OBGYNs, labor and delivery, and fetal assessment centers for expecting moms. This includes pre and postnatal care, breast and cervical cancer screening, and so much more. University of Maryland School of Nursing, also known as the AKA Rich 2.0. This program is an extension of successful Pathways program effort. A robust, and I do mean robust, collaboration of partners with interventions that include nurse-led clinics, mobile health outreach, and so much more. Healthcare for the Homeless Project addresses low birth weight infants and maternal mortality. They set out to improve early access to prenatal care for Black and Latina women experiencing homelessness in Baltimore City. That early access can be the huge difference that dictates the health and wellness of mom and baby. They are too providing prenatal care, linking moms to Medicaid and WIC services, and so much more. Greater Baltimore Medical Center, an amazing program that's with specific address for elders with diabetes, hypertension, weight challenges, who are maybe low income and frail. Interventions extending medical home hours at the Jonestown and Gilchrist medical care homes, providing care coordination and navigation and more. We have 2 HERCs that are providing services in Prince George's and Montgomery County. Interfaith works. This special organizations work under the HERC grant, addresses maternal health and substance use disorders for people experiencing. They not only provide emergency shelter, but their three-armed coalition assesses clients' needs, provides clinical care, and links them to mental and behavioral health services and so much more. Johns Hopkins University. During the Pathways phase, JHU stood up a much for sickle cell patients. They provide transition services to children 16 years and older with sickle cell disease. The purpose? To ensure that care continues as these children age out of youth program care. This was huge for Prince George's County residents who without it had to travel all the way to Baltimore for services. Can you imagine the challenges for some when they need immediate care? So this program serves an urgent need in Prince George's for that special patient population. We have 3 programs on the Eastern Shore. Somerset Health Department. This HERC project addresses diabetes and hypertension for at-risk patients with chronic disease in the lower shore. This program does so much. It does some critical things. It expands the reach of community health workers to provide care coordination and social support linkages. It utilizes mobile health. And what I think is an extremely strategic and centralized approach. The program's community health workers are strategically stationed in agencies where residents are already receiving services. There, they engage residents, assess needs, and connect them to much needed resources. Tidal Health, a previous Pathways grantee who did an outstanding job in the pilot phase. They are extending their reach in address of chronic health conditions and social support needs for African Americans and Haitian community residents in Worcester and Wacomico counties. Interventions include health and SDOH screenings, telehealth, healthy lifestyle programs, health literacy programmatic efforts, mobile health, and in-home visits for at-risk patients. Talbot Health Department, another HERC, addressing disparities in rural Maryland. Their efforts include addressing elder care, childhood vaccinations, clinical areas that include obesity, maternal health, Hispanic women and children, for Hispanic women and children and older African American adults in Talbot County. Interventions include women's cancer screenings, reproductive care, diabetes management. For Hispanic children, they provide health and social screenings, nutrition education, and vaccinations. Other program efforts include provide care coordination, chronic disease education for African American rural elder adults to improve their access to care. Our Western HERCs. The first, AHEC West, a robust collaboration of partners that link rural county residents to much needed care, be it primary, specialty, and/or pharmaceutical. Interventions include support for substance use disorder, remote medical monitoring by community health workers, and in-home visits. They even have a targeted arm of their program that administers street health care. I'm going to let them share a little bit more of that information in the breakout sessions, but information of more elements of their program as well. This HERC project addresses chronic disease, mental health, and access to care for Washington County residents. Again, this is huge for rural Maryland. Interventions include case management, in-home care, and lots of health education, community outreach, screening, assessment. Lastly, our southern region of the state, St. Mary's Health Department, continues to do great work in extension of their Pathways program success. This was a site that I personally visited, and I was extremely impressed with how well they literally did they literally did everything to meet their clients where they were at, providing on-site walk-in behavioral health, clinical, and prevention services. Their work addresses chronic disease, comorbidities, and counseling needs of residents in that area. As you can see, the HERCS provides that address the whole person. We have talked about the clinical, but what about those social needs areas? Those emergent needs that sometimes trump one's ability to prioritize their health. Do you recall in my beginning of my chat with you all today, we talked about the goal of the phase of funding per the legislation. It's not only longer interventions, but more emphasis on the social determinants of health areas, support the linkages, providing address to mitigate these barriers. Say that all of our grantees, they arose to that occasion. All of our grantees were required to provide services, resources, and linkages for a minimum of 3 social determinants of health areas in this phase of funding. And many of them provided those social needs, social determinants of health resources and linkages for up to 5 or more areas of support. Transportation, food, housing, social support, financial support, employment, workforce development, health literacy, and education, to name a few. Folks, I've done my best to give a brief overview of these programs and what they have to offer. And as I shared prior, I'm happy to say that our HERCs are all present and here to engage with you all directly. I always say there's no better person to speak on the what's and the whys of their program but them themselves. At this point, I believe we're going to be transitioning to our breakout sessions. Our HERCs are available to provide more information about their efforts, their services, and how to enroll. Folks, this is a great opportunity to learn, ask questions, and learn more. Whatever they share and all that I have shared, take it back to your organizations, take it for your platforms, whatever and wherever. So your are in the know. We want to drive traffic to the doors of these great programs. So at this time, I'm going to give a warm handoff to Stephanie, who's going to kind of get everyone situated in their breakout rooms. You guys will confirm those breakout sessions, and then we'll circle back right after for questions, more questions, and closing remarks. Stephanie?
Thank you so much, Deli. It's wonderful to hear about all these programs that are doing such important work across the state. So we are now going to open up breakout rooms so that you can learn more about the programs that are happening in your local community. There are going to be 5 of them, 1 for the Baltimore region, 1 for Montgomery and Prince George's County, 1 for Western Maryland, 1 for the Eastern Shore, and 1 for Southern Maryland. And you will be able to self-select which group you want to go into. There you will hear from the leaders of those programs about what they're offering and how we can help them meet their goals and reach the people that could really benefit from those services. And you will have the opportunity to ask questions and chat about how you are thinking about helping to spread the word. And so in a moment, my colleague Catherine is going to let you go ahead and go into those breakout rooms. So there will be a pop-up. It might appear in the middle of your screen. It might appear on the bottom of your screen. It could say breakout rooms. Sometimes you might need to hit the button on the bottom of the screen that is a circle with 3 dots that says more, and you'll see the option there to pick your breakout room. And if you are trying and you run into any trouble, we will assist you with that. Catherine, are those breakout rooms open for people to go in, or are they still on their way?
They are open.
Okay, great. So I can see, let's see, folks are starting to go into those rooms. Yes, I think folks are starting to go in.
They're not coming up for me on my list to join the breakout room.
Okay.
Neither for me.
Yeah, I don't see it as.
Interesting. Like 40 people are in. So that's
Yeah, not coming for me either.
let me see then.
Meanwhile, while we're getting that set up, we are going to share the slides for Nelly's presentation in an email after the event. And we'll also send some follow-up materials. Once you go into the breakout rooms, if there's a way you can change your name to add your organization, if you're from an organization, that'll kind of help the programs know who's in the room with them. And to do that, you can go put your cursor over your rectangle and hit the 3 dots in the upper right and hit rename. And that's how you can edit your name and add your organization. You'll also be able to do that in the chat once you go into your breakout room. And that
I'm
just
gonna
helps
close
everybody.
out and just try again just in case. I see some people joining, but if it's not coming up for most, I'm just gonna close and try them again. So give me
Okay, thank you, Catherine.
let me try that.
And then after the breakout rooms, we're gonna go until about 11:15. We'll all come back into the main room, and that'll give Nelly an opportunity to give some closing remarks, take some last questions about the program as a whole, and then Reverend Connor will help close this out. So hopefully we'll have some good discussions and then be able to come back together.